aggravations of 1 to 2 p.m. or 1 to 2 a.m. may be the primary symptoms to work with. Upon inquiry, one will probably see the fastidiousness, miserliness, and a certain degree of insecurity also. At this stage, particularly if the complaints are more functional, not involving much physical decay, it may be difficult to separate arsenicum from nux vomica. One must then search carefully for the psychological tendencies. Arsenicum will tend to be more insecure, needing the support of people, whereas nux vomica will be more self-reliant and impulsive. That is a key difference between arsenicum and nux vomica. Nux vomica would be self-reliant and impulsive. Arsenicum would need a lot of support from people. As the illness penetrates deeper, the arsenicum patient will manifest more anxiety, particularly anxiety about health, for he is afraid that he will die. At first, this anxiety may be most noticeable upon awakening in the morning, but it gradually occupies his attention throughout the day and night. It is also at this stage that the fear of being alone becomes a prominent factor. He will have a constant need for company, particularly at night. The fears of arsenicum are raised tremendously while alone. They're afraid when they are alone at night, they might die. The arsenicum anxiety causes great anguish internally, and out of this arises a tremendous restlessness known to this remedy. The restlessness is not a physical process, it is a mental restlessness, an anguished attempt to allay the deep-seated anxiety. He will move from place to place, from chair to chair, from bed to bed. He will go from person to person, constantly seeking reassurance and support. It is interesting for the homeopathic prescriber to note the difference between arsenicum and phosphorus patient in relation to the prescriber. While both have great anxiety about their health, the phosphorus type will plead for help to the homeopath, while the arsenicum type will demand it. The homeopath is bound to feel the weight with which the arsenicum patient will cling to him. Once they have reached that stage of development, no patients in our Materia Medica are so clinging and demanding of relief from their anxiety as are arsenicum and nitric acid. It is important to be able to distinguish the peculiar characteristics of arsenicum anxiety about health, as there are many other remedies having this characteristic also. The repertory lists these thoroughly and in relative strength, but is unable to describe the particular distinguishing qualities which are so important in separating one remedy from another. If one only knows the fact that a particular remedy has anxiety about health without knowing how to differentiate it from the others, one will find great difficulty in selecting the precise remedy that fits the patient. This cannot be done by a simple process of repertorization. It requires a minutely detailed knowledge of Materia Medica. The anxiety about health in arsenicum is really deep down inside, a fear of dying. The idea of his own death causes intolerable anguish to the arsenicum patient. It is not so much the fear of the consequences of a degenerating condition of death, of health, but the fear of the ultimate state of insecurity, that is death. For this reason, the arsenicum patient will exaggerate many symptoms, blow them out of all proportion. He will come to the conclusion that he has cancer, and will go from doctor to doctor, seeking someone who will confirm his fear. Even if all the tests are negative, he will not be consoled. His anguish, fear, and restlessness will continue to lead him to more and more doctors. He will fear that he has cancer because this is the symbol of fatal disease in our day and age. It is not really the possibility of cancer, but the prospect of death that causes him such anguish. It is also not a fear that he will get cancer sometime in the future. He fears that he has it now. Other remedies have a strong anxiety about health also, but in different ways. Calcarea carb has a strong anxiety about health, but more focused on the possibility of infectious disease, or particularly of insanity. Calcarea fears the insanity or infectious disease itself so much, the possibility of death. Calcarea can accept death with relative equanimity, but is much more likely to be caught in a despair over being incurable and not being able to recover. I have seen such a patient who is a Calcarea carb patient, and the interesting point is they're always afraid they would get insane. They would become insane and people would notice it. Kali carb has anxiety that he will get a disease in the future, whereas arsenicum fears he has cancer now. Kali Ars has a particular anxiety about heart disease. You may know certain people who have no disease. They would come, I have some pain, maybe is heart disease, I don't know. Think about Kali Ars. Think about ourselves also. Sometimes there would be pain in a particular sport, and doesn't travel anywhere. But the patient is anxious what this could be. give them some help. Sometimes it may be a heart attack. You should know what are the accompanying symptoms, and the if the pain is traveling upwards or into the left arm or towards the back, or if the pain has a particular character, if the pain is accompanied with sweating, vomiting, nausea, or anything like that. You need to be careful. Sometimes it could be a heart condition, and if it occurs in a patient in a particular stage of their life, or if there is a shock just before that, or if there is a chronic increase of cholesterol or something like that, you need to be careful with such people. But mostly there are people who just have anxiety and nothing else, and we need to be aware of such anxieties, deep-seated anxieties in people. And Kali Ars is a great remedy. If you have a patient who says, "If I must die, it is okay," but they have a fear that they have a heart disease. But if you begin talking about his heart, he will begin to express anxiety. Phosphorus feels anxiety about his health, but primarily when the subject is raised to him. Until you talk about health, phosphorus is no problem. Once you start talking about health, phosphorus becomes anxious. Many phosphorus fears revolve around health, his own or his relatives, but the phosphorus anxieties are not as obsessive. The phosphorus patient is suggestible. He hears of someone who has died from a bleeding ulcer, and then he imagines himself to have a bleeding ulcer. He does not hold his anxiety within himself, but he will grab the nearest person and animatedly express his concern. And that is, I had a patient like that too, who had such deep anxiety, and she became anemic eventually, and she needed some other help also for her anemic condition. But I know she is phosphorus, anxious about health. But if you give some assurance, they'll be fine. And they have this gastritis, desire for cold water relieves for some time until it becomes warm. So phosphorus will immediately go to the doctor, who reassures him that he does not have an ulcer. The anxiety then disappears as quickly and easily as it came. And the same thing happened to them. They went to the doctor, they did endoscopy, there was no ulcer, nothing was there, and they were relieved, saying to themselves, "How silly I am." By contrast, arsenicum, Kali Ars, and nitric acid are not so easily pacified. And I had arsenicum patient who is not at all pacified, and eventually they went to many doctors, and then they came back to me, demanding again with the same intensity the relief that they wanted. And I told them, see, this is how it works. They know the name of the medicine, and I think I made a mistake by telling them the name of the medicine. I should not have told them the name of the medicine, arsenicum, because now they wanted something else. Like arsenicum hasn't worked for them is what they think, but that is not true. Arsenicum 30 worked for them, 200 worked for them, 1M worked for them, 10M is what they were taking. There were slight aggravations and followed by relief. Many complaints already disappeared, but they still want a complete recovery, complete cure. Like nothing should be there. Asthma is healed, okay, fine, but there is also there is gastritis, and it needs to be completely gone. Like there should be nothing there. That's the level of cure they expect. There is a kind of perfectionism in arsenicum. In the work that they do also, they exhibit the same perfection. Kali Ars and nitric acid are also not so easily pacified. Nitric acid is always finding fault with others, So there was a guy, there is a person, very close to me, but they eventually came and told me the symptom of offensive urine, and that is when I gave them nitric acid. Until then, I didn't even think of nitric acid, though they gave me symptoms like stitching pains, and they were always demanding for cure, and always were chilly to begin with, and desire for cold drinks, weakness, characteristic weakness, but I didn't notice that weakness. I just attributed it to the heart condition that they had, saying that, okay, maybe because of the heart condition, they always feel weakness. But the weakness was also a significant indication of acid group of remedies, particularly nitric acid. But I didn't even, my mind didn't go there until I found this keynote, the striking thing, which was the offensive urine. It's very offensive. urine, the morning urine that I pass is very offensive. And the whole room is filled with that smell. I can smell it wherever I go. So that kind of offensiveness, ammoniacal offensiveness of urine. So I told him to drink a lot of water. He drinks a lot of water, but still the urine is offensive. Benzoic acid, nitric acid, these are the medicines for offensive urine. Benzoic acid usually is given for gout, and there would be other gouty symptoms accompanying. But if the patient is irritable, and if the patient is grumpy and vindictive, unforgiving, always holding grudges, always having some bitterness inside, unforgiving is the word, and always demanding immediate relief, and they're not getting sufficient out of you, think about nitric acid. They are inconsolable in their anxieties, arsenicum, Caliars, and nitric acid. Nitric acid patient, unlike phosphorus, always have anxiety about his health, and anxiety about any possible ailment, not only cancer, infectious disease, insanity, or heart disease. He may read in a magazine about someone with multiple sclerosis, and he will say to himself, oh, that explains it. That must be what I have. Naxomica can also have this symptom. So be careful. Don't straight away jump into nitric acid, which is a deep-acting remedy. Then instead of expressing his anxiety, he carries it around inside. Eventually, he may very secretively make an appointment with a doctor. But the doctor's assurances fall on deaf ears. He is convinced of what he has and cannot be consoled. Later, he may read another article, and the process begins again. The nitric acid anxiety about health is not so much the fear of death that we see in arsenicum. Arsenicum is, I'm going to die. See, this guy whom I talked to you about, the collector, the person who collected Bibles and antique pieces, and the person who is wealthy and who's afraid of becoming poor, and the person who is fastidious, very fastidious and very perfect, likes orderliness and cleanliness in everything that he does, and is a perfectionist. That person, he had this particular symptom of fear of death. And they expressed to me, well, if I die, these are the things you need to understand. I was like, man, you're not going to die with this disease. It's just a urinary tract infection. Nobody dies. I mean, you are not even in an hospital for this particular condition, and you don't even have any big symptoms, just a burning pain, and he feels you may die. That is the level of fear, the internal insecurity, and the whole house is near him. Everybody is consoling him that he will not die and praying for him that he will not die. And if there are people who see visions and revelations, and they will come and say, you may die, then it is like, the patient has deep-seated anxiety and insecurity already, and it becomes even more difficult to help such people in such conditions. The nitric acid anxiety about health is not so much the fear of death that we see in arsenicum. It is more a fear of all the consequences of a long-term degeneration. And I could feel this long-term degeneration difficulty inside that person, because they didn't want to become a liability to their wife or their friends. And that is when I gave them nitric acid. The fear of being a liability to others, with the expense, dependency on others, immobility, etc. And they would have splinter-like pains, stitching pains that can happen anywhere in the body. I wrongly gave spigelia for that stitching pain in their hands. I thought, well, something to do with the left hand, stitching pain traveling like this. Only one remedy was listed, spigelia, and I gave it, and it relieved. But the real picture came only after the offensive urine appeared, and then I understood, oh my God, well, I was missing this all along. Lycopodium has a marked anxiety about health. The lycopodium anxiety can be about any type of illness, like nitric acid, but is an anxiety that springs from a basic cowardice. Cowardice. This is English. It is not a fear of death, but a fear of the pain and torture of illness. He has a fear that he won't be able to cope with a serious illness, that he'll fall apart and reveal a lack of courage to others. So lycopodium people, they always want to look like, we are the macho men, like, the cool people. And very courageous. We can deal with anything boldly, and they are boasting about their courage and their lion-like